Hi dear doctors, welcome to Kidscovery. Myself Dr. Parv and we are discussing the syndromes, pediatric syndromes, and the syndrome for today is Trisomy 21. So I think an undergraduate or a postgraduate can only pass in the pediatrics exam, can only excel in the pediatric MCQs if he or she is thoroughly aware of what Trisomy 21 is all about. So trisomy, as the name suggests, see normally what happens, there are two copies, okay, which are going to be there of chromosome 21. But if it's one additional copy is going to be there, sorry for the bad drawing. Yeah, if there's additional copy which is going to come, that is called as trisomy 21. And now, what are the clinical features? Because these are very important when you have to, check for the Down syndrome in the clinical based cases. So see, the clinical features are like this: SHIT, Down syndrome. Okay, this is the mnemonic to remember: SHIT, Down syndrome. Whereas SHIT is actually proper. DOW is DOW, not N is there, and syndrome has got SYNDROME, all of things. Okay. So what is S? S for, of course, the neck is going to be short. H for thin hair. I for IQ level is just 20 to 75. T for transient leukemoid reaction, it's going to be there, leukemoid reaction. D for duodenal atresia. I'll teach you what are actually most important ones. These, this and this. These are actually important ones. Occiput is flat, wide ulnar loop. Okay. Then simian crease. This is also important, simian crease. Yellow skin, jaundice, no infertility. Delayed fontanelle closure, rolling of the eyes. Only male infertility is there, females are fertile, mentally ill, and epicanthic folds are going to be there. So these are important. Okay. So, and one more thing which is important is incurving of the fifth finger, clinodactyly, which sometimes they give some X-ray based questions also like this. So this is also important, incurving of the fifth finger. Okay. So just remember that the hand, this is the hand, this is the feet. So there will be short hands, short feet, which is going to be there, but that's not very important. Then narrow palate, not important, but yes, it is also one of the features. Overfolding of the helix of the ear, yeah, this is also important. Okay, overfolding of the ear, that's going to be there. So the three main causes of Down syndrome, first cause is actually the Robertsonian translocation. Now, what do you mean by Robertsonian translocation? You can just refer to the genetics video and you will get to know. Then you have got complete trisomy. Now, what do you mean by complete trisomy? That means we have got 47 plus 21, and sometimes there is mosaicism also. Now, what do you mean by mosaicism? So sometimes mosaicism as in not all the cells. So some cells will have 47 plus 21. Okay, like 47 chromosomes plus 21 chromosome extra, and some cells are going to be normal. Okay, some cells are going to be normal. So here the disease is going to manifest. Okay, disease is going to manifest but mildly. So disease is going to show you mild manifestations if it is a mosaic. But please remember that the most common one is actually the trisomy and nothing else. So what are the risk factors? Why does this happen? So please remember, Down syndrome is associated with D for Downs, D for Down syndrome, but age is not down, age is up. So it is associated with advanced maternal age, because it has been seen that after a certain amount of age of the female, the disjunction between the chromosome copies does not happen, and there is one more copy of trisomy 21 of 21 chromosome which is attached to the 221 chromosomes and is responsible for causing the trisomy 21. Please remember, this is the most common chromosomal abnormality disorder which is there in the live birth. So please remember, C and D coming together. C for chromosomal abnormality and D for Down's syndrome, and C for, of course, your common also, and it's the most common malformation syndrome as well. I have already told you that there can be many clinical features, but yeah, of course, intellectual disability. So D for disability and D for Downs is something which is really, really important. Now, I am going to show you some pictures also, because I have seen that they have, in the recent exams, they have started asking a lot of image-based questions. So can you see, this is an epicanthal fold which is going to be there. The nasal bridge is also flat. And here can you see, these are the brush field spots which are seen on iris. My work is only to tell you that there is a brush field spots on the iris, whereas the faculty of ophthalmology will in detail they are going to teach you about the brush field spots. Of course, epicanthal folds and flat nasal bridge is going to be there. Coming on to, if you see that there is a lot of gap, can you see this is a lot of gap between the first and the second toe, which is going to be there, that is called as sandal gap. I'm surprised. So there is something which is called as simian crease. Actually, please understand, simian crease is nothing okay. So see what happens in the hand. Okay, if I just make a drawing of hand. So this is the hand which I'm trying to show. Okay. Yeah. So in hand, mostly there is a single transverse palmar crease. Single transverse palmar crease, which is going to be there. Okay. And that is something which is called as Simeon's crease. Simeon's crease. Okay. S for Simeon's, S for single, C for crease. C and D comes very close. So D for Down syndrome. Okay. D for your Down syndrome. This is something you have to remember. Now, of course, they present with heart disease, and the most common heart disease is AV septal defect. Okay, AV septal defect is the most common heart disease which is going to be there in the Down syndrome. So, how to remember? Just remember, this is the atria, this is the ventricle. So, how to reach ventricle? You have to go from atria down into the ventricle. From the atria, go into the ventricle. So, down. Okay, go down into ventricle. Okay, so this is how you can remember going down. That means the Down syndrome has got AV septal defect. Okay, that's the most common problem. It's actually a form of endocardial cushion defect, because AV septum is something which is formed from the endocardial cushion. Of course, you will have VSD, ASD also, but the main problem is this AV septal defect. Now, it has been seen that there is increased blood flow across the pulmonary valve. So there is systolic ejection murmur which is happening in the case of these children. So can you understand, if there is a AV septal defect, that means AV septa is not formed properly. Okay, AV septa is not formed properly. So what is going to happen? The ventricles are going to receive high amounts of blood. Okay, high amounts of blood will be received by the ventricles, and that is why there will be ejection systolic. Okay, ejection systolic murmur is going to be there very high in the left upper sternal border, because there is increased amount across the pulmonary valve, and that's why there is a pulmonary hypertension also. So there is a loud S2 sound. Why? Because there's a lot of amount. So of course, lot of amount is go from the S2. So that's why there's going to be a loud S2 sound. Yeah, if there is VSD, then you will have a hollow systolic or a pan-systolic murmur which will be seen. GI abnormalities, please remember duodenal atresia is the most common one, and which is associated with annular pancreas. Please understand D and D coming together, D for duodenal atresia and D for Down syndrome. This is important, which is sometimes or most of the times associated with annular pancreas. Okay, so duodenal atresia, A for your annular pancreas. A for what? A for annular pancreas. So this is how you can remember. Then it can have imperforate anus also. So from A you can remember anus, which can be imperforate. Okay, anus can be what? Anus can be imperforate. And earlier we used to say this, that I is double E only. So E means esophageal atresia. So esophageal atresia is also something which is seen in these patients, and of course Hirschsprung disease is also seen. So this is something which you have to remember. Now see, this is important thing, that because amyloid substance is expressed on 21 chromosome. Okay, it is expressed on 21 chromosome. So the patients with trisomy 21, they will develop amyloid plaques and neurofibrillary tangles in the brain, with associated early onset dementia at around age of 40 years. So in Alzheimer's there is a lot of deposition of amyloid plaque, and as I've told you that amyloid plaque is expressed on chromosome number 21, the child who is suffering from Down syndrome is very highly likely to develop Alzheimer's at the age when the child is going to have 40 years of age. Okay, so these are actually the neurofibrillary tangles. This image based question has also been asked. This is called as neurofibrillary tangles. Now coming on to diagnosis. So how diagnosis is made? So there are actually some different things which you have to understand. So you can see you have got something which is called as papa, which has got ma, beta and aunt also. So what are these things? Papa means pregnancy associated plasma protein A. Ma means maternal age. Beta means beta HCG. Aunt means antenatal ultrasonographic nuchal translucency. The nuchal translucency if more than 3 mm. So all these tests are actually the first trimester test for the Down syndrome screening. Okay. Now I will leave you with a beautiful question, okay, which I'm sure your OBGY faculty has taught you. So that's why I'm leaving you with this question. What do you mean by triple test? What do you mean by quadruple test? Right? Quadruple test, triple test. Let me know about amniocentesis and chorionic villus sampling. Amniocentesis and chorionic villus sampling, and please let me know in what trimesters can you do that. Okay, in what trimesters can you do that. Coming on to yes, I have told you that what is nuchal translucency. See, nuchal translucency means there's an ultrasound which is performed between 12 to 14 weeks of gestation, and if it is going to show hypoechoic region. What do you mean by hypoechoic region? That's a black region. So if it is going to show hypoechoic region in the posterior fetal neck, that is called as nuchal translucency. Yes, we can do amniocentesis and chorionic villus sampling also, which I have asked you. Okay, rather I should say that it is done in first trimester only. Just tell me in which weeks do we perform amniocentesis and chorionic villus sampling. See, treatment of course is going to be supportive. I still remember my final year OSCE Viva had this question. Okay, so early childhood, I mean, what is the treatment? So of course early childhood intervention is something which is required to maximize the social and intellectual capacities. Then life skills training is something which is also important, and then surgery is required in the cardiac diseases, in the duodenal problems like duodenal atresia and endocardial cushion defects. Then you have got they are at a good risk, high risk of Alzheimer's disease. They are at a high risk of atlanto-axial axial dislocation also. This is also very, very, very important. Down syndrome people have got unstable atlas and axis. So atlanto-axial dislocation, or sometimes we say the cervical cord compression, is something which is a high risk in the Down syndrome. Then leukemia. So if somebody asks you, please remember translocation 821 is the most common translocation which is associated with AML. And of course 12 and 21 is also there for ALL, but AML is something which is most commonly associated with the Down syndrome. Coming on to the hypothyroidism, please understand hypothyroidism is also which is going to be there in the cases of Down syndrome. So the child should undergo the laboratory testing for it as well. So thank you so much. I just hope that you will never come down in your life and you will be always flying up, up, up and up. So thank you so much and God bless you.